In the fall of 2017, physical therapists Angela Makoviak and JFord from NorthShore University Health System spoke to a group of Myasthenia Gravis patients. They addressed exercise and MG. Here's an excerpt from their talk.
Now we're going to go into what we're calling the stable phase, when we can start to initiate some exercise. So the research that we found shows that functional strengthening, flexibility, walking, and breathing activities can improve your baseline function, which will decrease the effects of the exacerbation. It can decrease fatigue, increase strength, and improve functional mobility. So considerations when you're exercising. Weight-bearing exercises are extremely important because a lot of people are on steroids, which can cause osteoporosis. So weight-bearing activities are extremely important. You want to do activities that are low to moderate intensities, and you can see it's pretty small in your table, but up here, we want you to be between a 0 and 4. So while you're exercising, you want to keep asking yourself if I'm in that low to moderate intensity, and physical therapy would be able to help you determine what is low to moderate, because we don't want to get to the high intensity because that's going to cause fatigue. You also want to take multiple rest breaks, and that is something that we will also incorporate in physical therapy, trying to determine that. Monitoring your fatigue. No new onsets of symptoms like a drooping eyelid, and you should not have lasting fatigue greater than 2 hours post-exercise. So it's also important to be conscious that MG has a diurnal variability, so there's fluctuations of symptoms throughout the day. So some people are worse in the morning, some people are worse in the middle of the day. You have to work around your fluctuating fatigue throughout the day when exercise is best. I don't know if you've ever heard of the quote, dollar per day, but you don't want to use 75 cents of your dollar exercising. So you have to do what is appropriate for you, and physical therapy, again, can help try and figure out your tolerance. Exercise at your best time of day kind of goes along with that diurnal variability. Exercise at peak medication dose. So the article that we looked at said that the half-life of this particular medication is 4 hours, so exercising 1.5 hours to 2 hours post-medication, and then exercising larger muscle groups. So exercising after an exacerbation, you can continue those breathing exercises. Those are always great to do, and then the mindfulness exercises. But at this point, we can also start initiating strengthening, aerobic, and stretching. So what we did, we tried to make a generalized start for you guys. It's hard to generalize exercise when people are at different stages. They have different fatigue levels. They have different tolerance to activity. So if you are wanting to start an exercise program, go to physical therapy, because they're going to be the ones that are going to be able to help you put all of this together. So the recommendations for the ACSM is, and we kind of changed it based on patient population, so MG. So you want to do 2 sets, 8 to 10 repetitions of 3 to 5 exercises. And you want to do arms, legs, and core. You're going to alternate arm and leg days, and then you're going to do core activities daily. To progress, you can add light resistance bands, which Jen will show in a little bit, hand weights, cuff weights. You can also increase the amount of sets. But the amount of repetitions should be between 8 and 10. You don't really want to go any more than that, because then that's when the fatigue is going to hit in. Aerobic, it is recommended for brain health, 30 minutes of moderate exercise 5 times a week, or 30 minutes of vigorous exercise 3 times a week. However, that may not be appropriate for you based on your fatigue levels. So if you need to break it up into smaller parts throughout the day, then you need to do that. Again, physical therapy can help with that as well. But some ideas for aerobic is walking, the stationary bike, the arm bike, the new step. And you can start at 5 to 10 minutes, see how you react to that, and then try to progress that as much as you can, 1 to 2 minutes, and how you react to that, and see how your fatigue level is the rest of the day. Stretching, we put together on the next, this will be another handout, There's a hamstring, calf, piriformis, quad, low back, and the pec stretches. We just tried to give you a general overview of stretching to do. If you have any questions, again, please come in and see us. We tried to give you something that you could take home and try on your own, but if you are having difficulty, come in and see us. So you'll hold the stretch for 30 to 45 seconds. You're going to repeat 2 to 3 times on each arm or leg, and you're going to try to do that 2 times a day. So this is the leg stretches, and the arm stretches is another handout. It's back to back. The hamstring stretches, you can do it in sitting, you can do it lying down. There's other ways of doing it as well, but just so you have those options based on your functional level. Calf stretch you can do in standing, sitting. Piriformis stretch, which is basically in your hip. You can do that lying down on your side, change the angle. Quad stretch you can do in standing, laying on your stomach, laying on your side. So there's a bunch of different positions that we can get you in, especially based on any like low back pain that you may have that isn't an effect of the MG.